Hey everyone, Dr. Cody Scharf here, owner of Thrive Spine and Sport.
My name is Dmitry Altshul here, owner of Cedar CrossFit.
Today we're back for part 2 of our 5-part series on the CrossFit assessment in the squat. Today we're going to be talking about what may be the most commonly restricted assessment and movement, which is hip flexion. Okay guys, so to start, we're going to give you an at-home assessment so that you can see for yourself either how well your hip is moving or how restricted it is. So we have Dmitry here laying on the floor. To start the assessment, what you're going to do is you're going to bring one knee to your chest. So start raising up one leg. You can use your arm to grab the calf and pull it down to your chest. So a nice test here, go ahead and move that arm for me. A good assessment here is where the front of the quad is touching the bottom of the rib cage. Now, if you're having any pain in through the front of the hip or the front of the quad is not touching the rib, this motion is restricted and a positive test for hip flexion restriction.
The first stretch you could do to help with this hip to release it a little bit more. So if you have a couch at home, it's called a couch stretch. It's really pretty straightforward. So what you're going to do is you're going to put one knee right against the couch, one leg back. You're going to slowly push forward so you feel your hips open up and being in line parallel with each other. Once that happens, you kind of lift up your chest and get a deeper stretch. You put your hands on top and stretch even further until you feel that hip open up and become in line with each other. If you have one of these green bands right here, you'll be able to put the band around your hip, get a little bit more stretch this way. You back up, put a lot of tension on this band. You're going to sit right around your glute, right around your butt. Now you're going to do a very similar movement. We're going to push forward, push back, push forward. And you can put your hands on top of your head and turn as you go forward and get a nice stretch, kind of working that hip mobility all over the place. Part 3, what you can do, if you have a foam roller, to try to release some of those muscles around your hip. First thing we're going to do, set the foam roller right there. We're going to get on the inside of our thigh, and we're going to smash all the way down the inside of your thigh, nice and slow, creating some good pressure until you get all the way down to your hip, releasing some of that tension. And then part 2, get right on your butt, cross your legs like this, and start to smash on top of the bone, right on top of your butt, helping to release those muscles as well on your glute. This is our part 2 in our 5-part assessment. Look for some more information in the next video about a free squat and mobility assessment seminar that's going to happen here at Cedar Rapids CrossFit. If you have any questions about your squat, how to improve your squat, or how to get better, you can find us at www.cedarrapidscrossfit.com or shoot me an email at Dmitry, D-M-I-T-R-Y, at cedarrapidscrossfit.com.
As always, it's important to note that as you go through this assessment and at-home mobility strategy, that if you're experiencing any pain or you fail to see any improvements on your own, that you seek the advice of a medical professional. If you're in the Cedar Rapids area, I invite you to give me a call at my office, 319-423-0925, or request an appointment on our website, www.thrivespineandsport.com, or you can shoot me an email at dr.cody, C-O-D-Y, at thrivespineandsport.com. Thanks for watching.